In the shadows of mainstream science news, a remarkable breakthrough has emerged from an unexpected collaboration between South African and Brazilian researchers. Today we explore how quantum dot technology, tiny semiconductor particles most known for their use in display screens, has been repurposed to create a game-changing diagnostic tool for monkeypox virus detection. This innovation isn't just another incremental step in medical technology. It represents a fundamental shift in disease surveillance that could transform how we respond to emerging pathogens worldwide, especially in resource-limited settings. Join us as we dive into the science, significance, and future implications of this groundbreaking technology. Researchers from the University of Witwatersrand in South Africa and the Federal University of Rio de Janeiro have developed a revolutionary diagnostic tool for monkeypox detection that has largely flown under the radar of mainstream attention. Published in the Journal of Nanobiotechnology last month, this innovation represents a significant leap forward in point-of-care testing capabilities, especially for regions with limited laboratory infrastructure. What makes this development particularly significant is its timing. Monkeypox cases have resurged in Central Africa, with the Democratic Republic of Congo alone reporting over 14,000 suspected cases between 2023 and 2024. This crisis demands rapid, accurate diagnostic solutions that can function in challenging environments, precisely what this new technology delivers. To appreciate this innovation, we need to understand what quantum dots actually are. These semiconductor nanocrystals, typically measuring between 2 and 10 nanometers in diameter, possess unique optical properties that make them ideal for diagnostic applications. Their most remarkable feature is size-dependent fluorescence. Smaller quantum dots emit blue light, while larger ones emit red. This occurs due to quantum confinement effects, where electrons are restricted in movement, resulting in discrete energy levels rather than the continuous bands found in bulk semiconductors. The practical implication is profound. Researchers can create precise visual signatures when these dots interact with biological materials. While quantum dots have primarily been associated with display technologies and solar cells until now, their exceptional photostability and tunable optical properties have been ingeniously repurposed for medical diagnostics in this breakthrough application. The research team, led by Dr. Nombuso Mkhize, took quantum dot technology a crucial step further by synthesizing cadmium-free quantum dots using zinc, indium, and selenium. This represents an environmentally safer alternative to conventional quantum dots that contain toxic heavy metals, addressing a long-standing concern about quantum materials' environmental and biological safety. The synthesis process is remarkably sophisticated, involving controlled nucleation and growth under precisely managed temperature and pressure conditions. This careful engineering results in uniform nanoparticles with consistent optical properties, a critical factor for ensuring reliable diagnostic performance. By solving the toxicity problem that has limited medical applications of quantum dots, the team has opened the door to widespread adoption of this technology in healthcare settings. Perhaps equally significant to the technology itself is the nature of the collaboration that produced it. This development emerged from partnership between researchers in the Global South, challenging the traditional north-to-south flow of medical technology innovation. The collaboration between South African and Brazilian scientists represents a new model of scientific advancement, where countries with similar resource constraints pool their intellectual and material resources to develop solutions specifically tailored to their contexts. Dr. Carlos Oliveira from Rio de Janeiro contributed expertise in viral epitope mapping, identifying the precise viral protein regions that antibodies can recognize with high specificity. Meanwhile, the Witwatersrand team leveraged their experience with nanomaterials and point-of-care diagnostics developed during previous work on HIV testing platforms. This cross-pollination of ideas across disciplines and national boundaries demonstrates how complex health challenges can drive scientific innovation beyond traditional institutional and geographical silos. The diagnostic platform functions through a lateral flow assay, similar in principle to a home pregnancy test. Quantum dots are conjugated with antibodies specifically designed to bind to monkeypox viral proteins. When a patient sample contains a virus, the quantum dots bind to the viral particles and emit a distinctive fluorescence that can be detected with a simple handheld UV light. No sophisticated laboratory equipment required. The results appear in approximately 15 minutes, with impressive accuracy metrics, a sensitivity of 96.3% and specificity of 98.7%. These figures are comparable to laboratory PCR testing, but at a fraction of the cost, approximately $2 per test versus $50 minus $100 for PCR analysis. This combination of speed, accuracy, and affordability makes the technology particularly valuable for deployment in resource-limited settings where traditional diagnostic infrastructure is unavailable. The significance of this technology extends far beyond monkeypox detection. The quantum dot platform has been designed with adaptability as a core principle. The same basic architecture can be modified to detect other emerging pathogens by simply changing the conjugated antibodies. This versatility could transform epidemic response in regions where laboratory infrastructure is limited or non-existent. As Dr. McKay's noted, disease surveillance has historically been weakest in regions where novel pathogens are most likely to emerge. This technology democratizes diagnostics, allowing for rapid detection at the community level before outbreaks can gain momentum. This adaptability means the platform could potentially be quickly reconfigured to address future disease threats as they emerge, providing a flexible tool for global health security that doesn't require building entirely new detection systems for each new pathogen. The implications for epidemic preparedness are profound and far-reaching. Current disease surveillance models rely heavily on centralized laboratory testing, creating inevitable delays between sample collection and result reporting. These delays can prove catastrophic during outbreaks of highly transmissible diseases, where each day without intervention allows for exponential spread. By enabling accurate testing at the point of care, quantum dot diagnostics could compress the time between suspicion of a case and confirmation from days or weeks to mere minutes, enabling immediate isolation and contact tracing. The World Health Organization has initiated an expedited review of the technology for emergency use listing, which would facilitate its deployment in current monkeypox hotspots. If approved, it would represent one of the first quantum dot-based diagnostics to achieve widespread clinical implementation and could establish a precedent for accelerated approval of similar technologies in the future. Despite its enormous promise, several significant hurdles remain before widespread adoption becomes possible. Production scaling presents technical challenges, as quantum dot synthesis requires precise control of reaction conditions. The research team is addressing this by working with a South African biotech startup to establish a manufacturing facility in Johannesburg with the capacity to produce 50,000 tests weekly. This initiative aims not only to scale the technology but also to create skilled employment opportunities and build local capacity in advanced materials production. Another challenge involves the test stability in extreme environments. While room temperature stability has been demonstrated for up to 6 months, already a significant improvement over conventional antibody tests, questions remain about performance in extremely hot or humid environments. Field testing is currently underway in rural clinics in the Democratic Republic of Congo and Uganda to assess real-world performance under varying temperature, humidity, and dust exposure conditions. Preliminary results suggest that protective packaging innovations, including desiccant-lined aluminum pouches, may successfully extend shelf life even in these challenging environments. The researchers are taking the technology even further by developing a smartphone-based reader that would quantify fluorescence intensity, potentially allowing for viral load estimation and digital record keeping that could feed into regional surveillance networks. This digital integration could transform how outbreaks are tracked in real time across remote areas. The system would use a smartphone's camera with a specialized filter attachment to capture and analyze the quantum dot fluorescence, then transmit results to centralized databases via mobile networks. This approach cleverly leverages existing telecommunications infrastructure rather than requiring investments in new specialized equipment. By connecting point-of-care diagnostics to digital surveillance systems, health authorities could gain unprecedented visibility into disease emergence and spread, potentially containing outbreaks before they reach epidemic proportions. This integration of nanotechnology with digital tools represents a powerful convergence that could fundamentally alter our approach to global health security. As climate change and human encroachment into wildlife habitats accelerate, the likelihood of novel disease emergence increases dramatically. Technologies that bridge the diagnostic divide between resource-rich and resource-limited settings may prove crucial to global health security in the coming decades. The quantum dot diagnostic platform developed through this South-South collaboration exemplifies how cutting-edge science can be harnessed to address these pressing global challenges. The connection between environmental change and disease emergence creates an urgent need for diagnostic tools that can function at the front lines where humans, wildlife, and changing ecosystems intersect. By enabling rapid detection in precisely these interface regions, quantum dot technology addresses a critical vulnerability in our global health security framework. The ability to quickly identify and characterize new pathogens as they emerge from disturbed ecosystems could provide crucial early warning for potential pandemic threats, allowing for containment before widespread transmission occurs. The story of this innovation challenges conventional narratives about scientific progress. Rather than following the traditional pattern where advanced technologies are developed in wealthy nations and later adapted for resource-limited settings, this breakthrough emerged directly from the global regions most affected by the challenges it addresses. This contextually appropriate innovation model may prove more sustainable and effective than top-down approaches to global health technology. As Dr. Mackay remarked in a recent interview, the future of global health security depends not just on having sophisticated technologies, but on having the right technologies in the right places at the right time. This perspective highlights how innovation driven by local needs and constraints can sometimes produce solutions that are not just adequate substitutes for Western technology but superior approaches for specific contexts. The Quantum Diagnostic platform represents a case where necessity, expertise, and collaboration converge to create technology that is sophisticated in its underlying science but elegantly simple in its application. The Quantum Diagnostic platform, developed through collaboration between South African and Brazilian scientists, represents far more than just another medical device. It embodies a new paradigm in how we approach global health challenges, one where innovation flows from where it's most needed, not just from where resources are most abundant. By harnessing the unique properties of quantum dots, these researchers have created a tool that democratizes disease detection, bringing laboratory-quality diagnostics to the point of care in resource-limited settings. As our world faces increasing threats from emerging pathogens driven by climate change and ecosystem disruption, technologies like this that bridge the diagnostic divide may become essential components of global health security. Perhaps most importantly, this breakthrough challenges us to reconsider our assumptions about where scientific innovation can originate. The future of pandemic preparedness may well depend on nurturing such South-South collaborations and ensuring that cutting-edge science serves those most vulnerable to emerging health threats. In the convergence of quantum physics, virology, and grassroots innovation, we find not just a better diagnostic test, but a model for how science can serve humanity most effectively in our increasingly interconnected and vulnerable world. Thanks for watching. Please like, subscribe, and hit the bell icon for updates. Your feedback is appreciated. We hope to see you again.